Namaste everyone, welcome to Physio Vitals. I am Dr. Ankita Sawant and today's video is on phalanges. So, there are 14 phalanges in each hand, 3 for each finger and 2 for the thumb. Each phalange has a base, shaft and a head. Alright, so first we'll look at the base. So, in base, in the proximal phalanx, alright, proximals which means towards the body side. So in proximal phalanx, the base is marked by a concave facet, oval facet, alright, for articulation with the head of the metacarpal bone. Alright, metacarpal articulates with the proximal phalanx because the base is marked by a concave oval facet for the articulation with the metacarpal bone. So now in the middle phalanx or a distal phalanx, it is marked by two small concave facets separated by a smooth ridge. It is marked by two small concave facets which are separated by a smooth ridge. Moving further to the shaft. The shaft tapers towards the head. Alright, it tapers towards the head side. The dorsal surface is convex from the side to side. Alright, the dorsal surface, like posterior surface, is convex from side to side. The palmar surface is flattened. Alright, we are talking about the shaft. The palmar surface now, the anterior palm wala surface, is flattened from side to side but is gently concave in its long axis. Moving further to the head. In the proximal and middle phalanx, towards the body, proximal and middle phalanx, the head has a pulley-shaped articular surface. Alright, pulley-shaped articular surface. And is marked in the distal phalanx now, the head is non-articular. Obviously, there is no other joint forming apart from the middle and proximal phalanx, right? So, in distal phalanx, the head is non-articular and is marked anteriorly by a rough horseshoe-shaped tuberosity which supports the sensitive pulp of the fingertip. If we get hit very hardly on the fingertip, it causes immense pain. That's why it is called that the sensitive pulp of the fingertip. Moving further to the attachments. Now, base of the distal phalanx, the flexor digitorum profundus is inserted on the palmar surface. So base which articulates with the metacarpal head, right? So the flexor digitorum profundus is inserted on the palmar surface. Now the two side slips of digital expansion fuse to be inserted on the dorsal surface. These also extend the insertion of lumbrical and interosseous muscle. Alright, the two side slip of digital expansion fuses to be inserted on the dorsal surface. These also extend the insertion of lumbrical and interossea muscles. In middle phalanx now, the two slips or flexor digitorum superficialis are inserted. Flexor digitorum superficialis, that was flexor digitorum profundus. Here in middle phalanx it is flexor digitorum superficialis is inserted on its side, on each side of the shaft. Alright, each side, right and left, lateral and medial side of the shaft may it is inserted. Next is the flexor sheath is also attached to the side of the shaft. A major part of the extensor digitorum is inserted on the dorsal surface, posterior surface में extensor है, so all extensor muscles will be on the dorsal surface which is posterior surface and flexor will be on the volar or palmar surface. Alright, so a major part of the extensor digitorum is inserted on the dorsal surface of the base. Now proximal phalanx. The fibrous flexor sheath is attached to the sides of the shaft. On each side of the base, parts of the lumbrical and interossea are inserted. Flexor sheath is attached to the sides of the shaft, and lumbrical and interosseous on each side of the base, parts of the lumbrical and interosseous are inserted base mein. All right. Now thumb and the base of the proximal phalanx provides attachment to the adductor pollicis brevis and flexor pollicis brevis. Alright, abductor pollicis brevis and flexor pollicis brevis is inserted on the lateral side. Alright, lateral side mein these two muscles are abductor and flexor pollicis brevis. Then adductor pollicis and the first palmar interossea, adductor pollicis and first palmar interosseous are inserted on the medial side. The first two are on the lateral side and these are on the medial side. Alright. Then the extensor pollicis brevis is inserted on the dorsal surface. Obviously, as I mentioned before, that all extensors will be attached or origin from the dorsal surface only, which is the posterior surface. Now in the little finger, we have the middle side of the base of the proximal phalanx provides insertion to abductor digiti minimi and flexor digiti minimi. We have abductor digiti and flexor digiti minimi. Moving further to the ossifications. Ossification, the shaft of each phalanx ossifies from shaft, okay? Shaft ossifies from primary center. Alright, each phalanx ka shaft ossifies from the primary center, which appears during the 8th week of development in the distal phalanx. 10th week in the proximal, alright, 10th week in proximal phalanx and 12th week in the middle phalanx. Now, the secondary center appears for the base during 2 to 4 years. Alright, now base ka ossification is done by secondary and that is 2 to 4 years and fuses at 15 to 18 years. Alright, so shaft is by primary center, base is by secondary center. 8 week is distal phalanx, 10 is proximal phalanx and 12 is middle phalanx. Base ka is 2 to 4 years and fuses about 15 to 18 years. Moving further, see, this is the diagram appearance. This is the base, shaft, this is the shaft and head. Alright, so this is proximal, middle and distal phalanx. Same way, proximal, middle, distal, proximal, middle, distal phalanx. Alright, so now as you can see in this diagram how they have shown the fusion when the bone fuses and everything, as I have already mentioned in here. Now moving further to the clinical anatomy. Fracture of distal phalanx of the middle finger. Middle finger's distal phalanx fracture is the commonest. Alright, middle phalanx, fracture of distal phalanx of middle finger, alright, is commonest. It is treated by splinting the injured phalanx to the adjacent normal finger. This is called as buddy splint. See, this is buddy splint. Alright, so middle finger ka distal part is fractured. This is the middle finger, this is the distal part. So if here it is fractured, so it is splinted with the help of the normal finger. Alright, that's why it is called buddy splint. I hope the video was useful and informative. Do not forget to like, share and subscribe to my channel. See you next in the muscle sessions. So stay tuned for that. Thank you.